Outbreaks tied to norovirus and Shigella have been making news recently. Here's what to know.
Shigella is a bacterium and norovirus is a virus, but they both cause a syndrome that we call gastroenteritis, which to the person who has the infection is going to be some combination of GI symptoms like nausea, vomiting, abdominal cramping, and diarrhea. When you have these infections, the symptoms resolve, but you still carry and shed the bacteria for a period of time beyond that. It can be days to weeks for Shigella. Norovirus can also be carried for weeks. And the problem is then you may feel that you're perfectly fine and you travel around and do your own business, but you may still be infectious to others.
Since they're different types of infections, their timelines are also quite different. For norovirus,
it can be quite miserable to have, I can say from experience, but it's usually short-lived. So people are often better by 24 or 48 hours, should be feeling much more back to normal by then.
As for shigellosis, which is the infection caused by Shigella,
it also can go away by itself, but it takes more like days to weeks. And if we treat it with an antibiotic, which wouldn't be useful for a virus, but for Shigella, we can treat it with an antibiotic and then the symptoms can go away faster. The problem is that Shigella is becoming more and more resistant to the common antibiotics that we use.
To learn more about who's most at risk from a norovirus or Shigella infection, visit the UW Medicine Newsroom.